We have elections in Germany this year, too.
And they're choosing a pope.
Yeah, thank you for the opportunity to describe a little bit our study. There's still a debate whether off-pump, that means avoiding cardiopulmonary bypass, has a benefit in the clinical outcome for patients undergoing coronary bypass surgery. Recent trials could not demonstrate this benefit, and what is a little bit worrisome, one of the trials published in 2009 by Schroers and colleagues showed that there may be a worse outcome in terms of the quality of the anastomosis and revascularization, and that could even drop the survival over 1 year in their study. So we, the German Society of Cardiac Surgery, intend to make a study for patients which are exclusively elderly, more than 70 years of age. We put together experienced centers, 12 German centers, and we nominate expert surgeons for doing the procedures. We came up to include from eligible patient for randomization, which were 3,600 around. We could randomize 2,900, which means an inclusion rate of nearly 70%. Our primary endpoint was that one of the procedures should reduce a combined composite endpoint consisting in death, stroke, myocardial infarction, repeat revascularization, and new onset of renal therapy. The results at 30 days could not demonstrate any difference in between on and off pump. We saw a little, by figure, a little higher rate of repeat revascularization in the on-pump group, but this was by figure 15 events versus 5 events, and it was not statistically significant. A secondary endpoint, we looked for resource utilization, and we figured out that a few more patients received compound blood transfusions in the on-pump group, and those patients who received any blood transfusions were a bit higher in the on-pump group. Interesting is the 12 months follow-up, which was another secondary endpoint. In the 12 months follow-up, the primary result after 30 days did not change for any single parameter, and it did not change for the composite of the major events. That means the odds ratio for that group was 0.93, and the threshold for being significant would be an odds ratio of 0.63. So it is a very robust and solid result. That means at this point, even for this elderly patient group, we do not see major benefit of one of the techniques versus the other in terms of major cardiac event. Thank you.
Thank you very much, Dr. Diegeler. And I think what we'll do is we'll have presentations from all three of our surgeons, and then we'll have plenty of time for questions directed to them. Thank you.